Welcome back to KDTV.com. We're here with Dr. Ishu Rao, who is an electrophysiologist.
That is correct.
Okay, so in your earlier presentation, you talked about what it is that you do on a daily basis. So can you give us just a little bit of background about what that all means?
So electrophysiology is a subspecialty of cardiology.
Okay.
And really what it is that the heart has different facets to it, and all I deal with is the electrical problems of the heart. Okay. So in a practical matter, what I do primarily is I do catheter ablation procedures for heart rhythm disturbances, and I implant pacemakers and defibrillators. That takes up probably 85% of my time.
Okay, so for the people that don't understand what all that language means, basically the heart kind of short circuits?
Yeah, that's one way of looking at it. And some people have extra electrical wiring. Some people develop extra electrical pathways, and their heart will suddenly take off and race. And when that happens, they feel lightheaded, they feel dizzy, they feel short of breath, they feel bad, they can't do the same level of exercise. There's a variety of different reasons that these things happen, and it's my job to figure out why that happens and to fix it.
Wow, so where'd you get your education?
Oh, kind of everywhere. I was born in Pittsburgh. I went to Penn State for undergrad. I went to Jefferson Medical College in Philadelphia. I did a residency in internal medicine in Houston at the Baylor Medical Center. Did 2 fellowships in Los Angeles. Then I practiced in Texas for 4 years, and I've been here for 4 years now.
So then you decided that Ventura County was a really great place to live.
I really did. I came out here. I had actually, I had trained in Los Angeles, and my wife and I were dating at the time, and we would drive up through here and spend time in Santa Barbara and Ventura and have fun. And we're like, if there was ever an opportunity to go back, let's do it. And there was a group that was really their electrophysiology was really underserved in this area, and the group and the hospital put together a program that they said they needed someone to head, and they found me, and it worked out for all of us.
Well, that's great. So we all know, because we live here in Ventura County, that it's a wonderful place to be. And so you're located in Ventura?
I practice in Ventura. We have an office in Oxnard also. I'm with the Cardiology Associates Medical Group, and we're a 9-man group that kind of takes care of all aspects of cardiovascular disease, from putting in pacemakers and defibrillators, putting in stents, peripheral vascular disease, anything that has to do with the heart or the vascular tree we take care of.
So I was surprised during your presentation when you talked about what the #1 killer of people is here in the U.S. So can you elaborate on that? Absolutely.
The #1 cause of death in this country is sudden cardiac arrest.
Wow.
And, we don't think about that at the forefront. We hear people, dying of heart attacks, but we think more about, lung cancer and breast cancer, which are absolutely, causes that we need to be involved with. But we also need to recognize that sudden cardiac arrest kills more people, 350,000 people a year. That's almost 1,000 people a day.
Wow.
It's pretty impressive. And we're trying to work hard to carve that number down.
So if anybody wants to get a hold of you, how do they do that?
A couple of different ways. Our office number is 805-653-0101.
Okay.
Our website is www.cardiacadvantage.com, and those are probably the 2 best ways.
Okay, super. So how'd you get involved in this health fair?
I do a fair amount of speaking, and I think we always have our feelers out to see what the community needs in our group. And our marketing director said, you know what, they're doing a health fair up in Ojai. It seems like something that we should help support. And I said, yeah, I'd love to give a talk if they would like that, or what else can we do? So we're actually doing heart rhythm screening here, which is something that doesn't happen often, but we have one of our medical assistants and one of my partners is going to just, put electrode leads on the wrists and tell you what your heart rhythm is.
So this may sound a little odd, but I hope I don't see you.
Right.
But if I do, it sounds like that you're very passionate about what you do and located here in Ventura County. And thank you so much for being out here and volunteering your time.
Oh, you're very welcome. And we enjoy it. We love being part of this community. We love taking care of the patients. Super grateful population. So it's been a pleasure to practice here.
Thank you so much. So if somebody wants to do some proactive steps in order to not come in to visit your office, what are some very simple ways that they can improve their health?
The basic things you've heard about since you were 3 years old, eat well, exercise regularly, things like that, and see a doctor regularly. That's one that I just turned 40 last year. That was one I had to start getting used to as well. But it's very important. You'll find that there's little things that might not be obvious that need to be managed. So prevent those little things from getting bigger, and you might do okay.
Well, thank you very much for being here today. Here we are at the Ojai Valley Health Fair with Dr. Rao, the electrophysiologist right here at Ojai. Thanks so much for being here at KDTV.com.